I told you you could enjoy the sport of running and avoid the aches and pains that come with it? I know it seems impossible, but we are learning how with Dr. Joshua Blomgren he's a sports medicine physician at Rush and team physician for the Bank of America Chicago Marathon. And there are so many people out there right now who are training, and I think the first thing they do is go too far, too fast.
Exactly. It's one of the most common mistakes we see runners make is that at this time of year they're starting to build their mileage towards that goal of 26.
Sure.
For most in October with the Chicago Marathon, and really they just build too quickly and are doing too much too often, and that's where they run into problems.
At these statistics that you sent, and it says 50 to 80% of runners are going to suffer an injury during any given year. It made me feel better. I was at least in good company because I'm always having knee pain. But I'm surprised at how many people are doing this wrong.
Yeah, and with the popularity of marathons and endurance events, people are following training programs, and I would say that the programs aren't a catch-all.
Right. Well, the first mistake, I think, are the shoes. First of all, we need the correct shoes, but secondly, they wear out when you're putting that much mileage on.
Right. I would recommend going somewhere and having someone put you in the right shoe type for your foot and your running style, and then just being mindful of how many miles you're putting in. You want to replace your shoes anywhere between 300 and 500 miles of wear.
Right, and for some people that's in 3 to 5 months, and
exactly.
So you don't realize that it comes up that quickly. I think the other thing that we need to talk about is, especially in this heat, the clothing to wear, because it's not comfortable, and then you can't even continue.
Right, the technical fabrics are very, very popular, and what they do is wick sweat away from the body. They help keep you cooler while you're out running in this hot Chicago weather.
Right, it's not the days of our old cotton t-shirts.
Exactly.
That's for sure. Okay, and nutrition is important, both pre and post workout.
Right. You want to make sure that you're putting good fuel in your body, some carbohydrates, some good proteins, and then also if you're on these big long runs, you want to replace some of those carbohydrates you lose, and then also at the end of a long running activity, you want to replace some glucose so that you can replace those stores so that when you run the next time you're not depleted.
Carbohydrates before, protein after?
Protein after, but also carbohydrate within the first 2 hours afterwards.
Okay.
Just to replace those glycogen stores.
Now, I have a debate with my kids all the time about these sports drinks, because I say, you have to be working out really hard to drink a giant bottle of one of these.
Exactly.
So mix up the water and the Gatorade, right?
Right. Generally, the rule of thumb is if you're exercising under an hour, water's really the best replacement fluid. Anything beyond that, or if it's hot and humid and you're sweating excessively, then you want to use something like a sports drink to replace some of those electrolytes that you lose.
Okay, now let's also talk about the stretching, because that is the thing that is going to prevent injury. It's going to help you heal afterwards, and I don't think any of us do it really well or correctly. So let's talk about some really important stretches.
Well, first of all, you want to focus on dynamic stretching, which is where you're actively moving the muscles while you're stretching, and we have our models doing a couple of examples of that, and that's been shown to help prevent injury, and it's best done before.
Okay.
And then afterwards, you want to do more of a static stretch, which is the traditional sit and reach, or standing and reaching, and some of our models here are doing more of the static stretching.
I'm glad you said that, because I think there's been some debate about, do you stretch before? So it's the type of stretch before. The dynamic stretch is better before, and the static stretch is better afterwards.
Correct.
Okay. So can we go through exactly what some of the really good ones are to do to prevent? Because I think knee problems are a big problem.
A big problem, and I would say just focusing on the major muscle groups. John here is stretching out his hamstrings. This is the example of the static stretch. And then we see Hannah over there stretching out the groin muscles, leaning to the side, and then on the end we see the quadriceps stretch.
Okay, well this is all perfect. You can watch them again, and you can try to imitate them at home by going to our website, WGN-TV.com/midday. Thank you all for your help. Thank you, Doctor. I really appreciate it. This is such important information, and you can, we'll have a link to Rush Ortho from our webpage. We'll be right back.